The trapezius muscle is a large triangular muscle at the back of your neck and upper back. Its shape resembles a diamond or trapezoid. The muscle attaches to the skull, spine, and shoulder blades. It's part of the outer layer of back muscles, working with muscles like latissimus dorsi and rhomboids. Even though it's in the back, the trapezius mainly helps with shoulder movements, so it's considered more of an upper limb muscle than a back muscle. On this episode of A Healthy Dose, we will discuss the detailed anatomy and function of the trapezius muscle. The trapezius muscle originates from various points along the middle of the back and neck. The superior fibers connect to the medial portion of the superior nuchal line, the external occipital protuberance of the occipital bone, and the nuchal ligament, which in turn is linked to the spinous processes of the C1 to C6 vertebrae. These fibers follow a downward trajectory as they approach their attachment site, which is why this segment of the trapezius is known as the descending portion. The middle fibers arise from the spinous processes of T1 to T4, or according to some references, C7 to T3 vertebrae and the ligaments between them. Running horizontally, these fibers extend toward the shoulder, constituting the transverse segment of the trapezius. The inferior fibers originate from the spinous processes of T4 to T12 vertebrae and their corresponding supraspinous ligaments. These fibers ascend in a superior and lateral direction toward their attachment point, forming the ascending section of the trapezius. During their trajectory, the trapezius muscle fibers converge towards the superior angle of the scapula, where they attach to their designated insertion points. The upper fibers connect to the posterior border of the lateral third of the clavicle, while the middle fibers attach to the medial margin of the acromion of the scapula and the superior crust of the scapular spine. The lower fibers insert through an aponeurosis onto a tubercle located at the lateral apex of the medial end of the scapular spine. We can categorize the trapezius into three functional divisions. Each of these divisions plays a role in distinct movements. The segments of the trapezius consists of: number 1, the descending part, comprised of superior fibers. Number 2, the transverse part, comprised of middle fibers. Number 3, the ascending part, comprised of inferior fibers. Among the superficial extrinsic back muscles, the trapezius, along with the latissimus dorsi, holds the most superficial position. It overlays the remaining muscles in this group, namely the rhomboids and levator scapulae. Deep beneath the trapezius muscle, we encounter the serratus posterior superior, which falls within the intermediate layer of extrinsic back muscles. Additionally, the trapezius serves as a covering for several muscles belonging to the superficial layer of the intrinsic muscle group. These include the splenus capitis, splenus cervicis, spinalis, longissimus, and iliocostalis muscles. The upper section of the trapezius also overlays the suboccipital region. The anterior margin of the trapezius muscle forms the posterior border of the posterior triangle of the neck. Moreover, its free inferior margins form the medial boundary of the triangle of auscultation, an area of the chest wall not obscured by the scapula and only covered by a thin layer of muscle. The trapezius muscle stands out among the upper limb muscles as it does not rely on the brachial plexus for its innervation. Instead, the accessory nerve, cranial nerve 11, and the anterior rami of the C3 and C4 spinal nerves provide motor innervation to the trapezius. Additionally, these spinal nerves carry proprioceptive and sensory fibers from the muscle. The arterial supply to the trapezius varies depending on the level. The descending part of the muscle is supplied by transverse muscular branches arising from the occipital artery, which is a branch of the external carotid artery, which passes along the deep surface of the muscle. The transverse part of the muscle is supplied by the superficial cervical artery, or by a branch from the transverse cervical artery. The ascending part is supplied by muscular branches of the dorsal scapular artery, which arises from the subclavian artery. The actions of the trapezius muscle is largely dependent on the direction of the fibers that are contracting. The descending fibers act with the levator scapulae muscle to produce an elevation of the scapula. The ascending fibers are responsible for depression of the medial part of the scapula and thus lowering the shoulder. The transverse fibers act together with the rhomboids to produce a retraction of the scapula by pulling it towards the midline. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.